In today's video, we will discuss everything you need to know about colic cry in babies. Here we will find out why do babies cry, decoding the secret behind. How much cry is normal and how much is abnormal in a baby? What causes excessive cry in a newborn? What is colic cry and its characteristics? What is rule of 3 of colic? How does a colic baby appear? At what age colic goes away? What are long-term effects of colic on baby and parents? How to soothe a colic baby? And how to relieve or treat colic? 5 warning signs of colic. And how to prevent colic. Let's get started. Why does a baby cry? Crying is a signal from baby that something is wrong, as there is no other way to verbalize its thought. Hence, crying tells that a baby is in need. But what exactly is the need? That has to be figured out by caregivers, which may become too perplexing sometimes. Is crying good or bad? Crying is a normal part of neurodevelopment in a baby. Hence, crying is basically good. How much cry is normal and how much is abnormal? On an average, a newborn cries for about 2 hours a day till first 6 weeks of life. Afterwards, gradually this duration reduces. Crying for more than 3 hours a day is called abnormal or excessive. What causes excessive cry in a baby? 7 common causes here. First is hunger cry. Second, diaper rash or nappy rash. Third, to seek attention. Fourth, overstimulation. 5, too hot or too cold temperature. 6, uncomfortable clothing. 7, caffeine intake in mother. Other causes of excessive cry in a baby: a tired hair or thread around finger or genitalia, ear pain as in common cold or ear infection, etc., nose block as baby is unable to feed, torsion of the testis that causes redness and swelling around the same, foreign body, for instance insect inside nose, ear, corneal abrasion that causes excruciating pain, infections like pneumonia, meningitis, gut conditions, for instance intussusception, volvulus, etc., cow milk allergy or lactose intolerance, urinary tract infection, gastroesophageal reflux or GER, infantile colic or colic. What is infantile colic? It is called infantile colic when an otherwise healthy and well-thriving baby cries excessively and inconsolably for hours together, and crying does not stop by comforting or feeding the baby, with no apparent underlying reason. So basically, colic is an abnormal, excessive, prolonged, inconsolable cry in a healthy baby with no underlying cause. How common is colic? Around 20% of babies seek medical attention for excess cry in colic. This is how common colic is. In layman's language, 1 in every 5 babies suffers from colic. Which babies are more prone for colic? Breast and infant baby are equally prone for colic. Babies with altered gut flora with more E. coli are more likely to get colic. Psychosocial environment, example family issues, also plays a role. There may be familial or genetic predisposition to colic as well. Gender, race, socioeconomic status has nothing to do with colic. What are symptoms of colic? In colic, there is a loud and high-pitched cry that sounds like an urgent call for help. It is common in infants of less than 5 months of age. Colic cry peaks at 6 weeks or 1.5 months of life. It is more common in evening or early part of night. In colic, even if crying stops, baby remains fussy and irritable throughout. It is usually associated with gaseous distension of tummy and frequent passages of gas. How does a colic baby appear? It has flushed face, fisting of hands, arched back, knees drawn up to abdomen, tight tummy, loud and high-pitched cry. When does colic go away? Usually after 3 to 4 months of age, colic cry goes away. Only in 5% of babies, it is seen to persist beyond 3 months. At maximum, it will linger up to 6 months of age. If excess cry persists in a baby beyond 6 months of age, that means baby is at high risk of developing behavioral problems later in life. What is rule of 3 of colic? Colic starts by 3rd week of life. Here baby cries for more than 3 hours a day and it occurs for more than 3 days a week. Crying lasts for more than 3 weeks and resolute by 3 months of age. Effect of colic on parents. Colic is responsible for sleepless nights, distress and anxiety in parents. It evokes self-blame and guilt in them as if it is their fault. Again, it can precipitate postpartum depression in mother if baby cries continuously. It reduces breast milk secretion in mother and weaken mother-baby bond. Parents, if shake baby aggressively, it leads to shaken baby syndrome that harms baby's brain. What parents should do if baby has colic? Parents should take time out or break in between. They should take help of other family members and caretakers to avoid exhaustion. Effect of colic on baby on short and long term. Good news is colic has no harmful effect on a baby in long or short run, hence parents should stay assured. Soothing techniques for colic. How to calm down a colic baby. Putting baby in a relatively dark and noise-free environment with minimum stimulus helps. Swaddling makes a baby feel comfortable as if it is inside mother's womb. Holding the baby in arms relaxes a baby sometimes. Rocking movement helps to calm down a crying baby too. Swinging baby in a cradle or swing sometimes puts a baby to sleep. Stroller ride or car ride in many instances has seen to benefit. White noise or zero music is comforting as well, but it should not be used frequently. Carrying baby and going for a walk helps as well. Warm bath at times soothes a baby and put a stops to crying. Letting baby latch on mother's breast will benefit if it is a hunger cry. Singing lullaby, as you might know, eases off baby sometimes. And putting warm cloth on tummy may be considered. So to sum up, here is a complete list of how to calm down a colic baby. Minimize stimuli, swaddling, holding, rocking, swinging, stroller ride or car ride, white noise or zero music, carrying baby and walking, warm bath, letting baby feed, singing lullaby. How to diagnose colic? Colic is a clinical diagnosis of exclusion, which means someone need to rule out all other organic causes of excessive cry to say it is colic. Pediatrician is the best person to diagnose and treat colic. How to relieve or treat colic? Treatment of colic. Soothing techniques like swaddling, holding, swinging, rocking movement, stroller ride, etc. might help. Pharmacological treatment, example simethicone, is used for babies which are in too much discomfort. Fennel oil and dill oil might help as well. Lactase drops rarely may benefit if there is an underlying lactose intolerance. Hydrolyzed infant formula help in case of proven cow milk allergy babies. Probiotic supplements like Lactobacillus reuteri can be beneficial as per few studies. What treatment not to give in colic? Dicyclomine is a symptomatic antispasmodic. It is not recommended to use in babies of less than 6 months of age due to potential risk of side effects. Never use sugar solution, gripe water, Bonasan, fennel water, as there is hardly any evidence that these work. Rather, there is an added risk of introducing infection to the baby. Counseling parents regarding colic is the primary cornerstone for diagnosis and treatment of infant colic. What are 5 warning signs of colic? If any of these 5 signs are present, along with excessive cry, then take baby to physician promptly. Fever more than 100.4 degree Fahrenheit, persistent vomiting, blood in stool, lethargic or sick-looking baby, baby not feeding well. How to prevent colic? Schedule breastfeeding every 2 to 3 hours along with demand feeding will help. Burping for at least 10 to 15 minutes after each food will help in get rid of excessive gas. Massage baby, especially tummy massage, will also take out excess tummy gas. Do not massage during active colic episode. If mother avoid taking a caffeine containing product, then it is better. Avoid certain foods like cruciferous vegetables might help. In rare cases, if strong family history of allergy is present and mother refrains from potential allergy causing food, then it might benefit. Caution: a lactating mother should never compromise on her diet. She should not quit certain foods on her own. A lactating mother should always consult a physician before discontinuing any food. Take home message. Often it happens that when a baby develops colic, parents tend to self-blame. Also, sometimes mother is blamed for not taking good care of baby properly. But fact says otherwise. Colic is a normal and physiological mechanism and is a sign of standard developmental phenomenon. 1 in every 5 baby will get colic, and it has nothing to do with parents or parenting method. Here is a question for you. Does colic have any harmful effect on baby in long term? Yes or no? Answer in the comment box below. If you like this video, then hit the like button, share this video maximum, and also do not forget to subscribe to this channel. See you in next video. This video is for educational purpose only. We are strictly against self-diagnosis and self-treatment.